Hey, welcome back to Twin Cities Live. Paul Folger filling in for Ben Lieber today. Thanks for being here, sir.
Happy to be here.
Well, I'm glad you're here. We've got a big topic right now. February is Cancer Prevention Month. So if you haven't booked any cancer screening appointments for the year, we'll encourage you now to put those on the old calendar.
Now's the time to do it. We've got Dr. Jennifer Carroll with Minnesota Oncology here in the studio with some questions about cancer prevention and then some steps that you can take to protect yourself from cancer. So it's an important thing to do.
Big thing. Nice to have you here.
Thank you. It's nice to be here.
Okay, it kind of feels sometimes like an overwhelming topic because there's so many different kinds of cancer and there's all these different factors. So we're going to try to break it down a little bit to a couple different kinds, breast cancer and melanoma. So screenings, what do you like people to know about breast cancer screenings and then melanoma screenings?
So I think the biggest thing for breast cancer is to first off to have a good idea of what your risk is. So the American Society of Breast Surgeons now actually recommends that we talk about what our risk is starting at age 25.
Wow.
So most of us are going to be recommended to have a mammogram starting at 40, but there's certain women that may be at a higher risk, and that could be based on your family history, personal risk factors, but it's important to try to identify that as early as we can. If we have women that are at higher risk, we may recommend increased screening for them or maybe even starting earlier. But for the average woman, we'll recommend starting a mammogram at age 40.
At 40. So, but if you are a woman at 25, do you need to, and your doctor's not mentioning it, should you just bring it up yourself and ask?
Absolutely. I think that's very reasonable to just kind of say, hey, I heard about this. What do you recommend or what do you think about this? I think a lot of the gynecology providers, especially here in the cities, have a very good understanding of assessing those risks for patients.
This is, I think, just another example of what makes me feel so good about where we're going in medicine, which is less of this sort of one size fits all. Everybody, it's this, and you got to fight about the, it's really dialing into the individual and having those conversations. So when it comes to melanoma, what about people get all weirded out about the screenings for this because they're like, I got to strip down and then they got to see me all, at some point it's like a body is a body, so it's not that big of a deal.
That's true, and I think especially when you're on the provider side of things, I think for them that is very normal. So, and I think most of the providers that are doing these exams are going to do everything they can to really make sure you're as comfortable and at ease as possible, because they know the importance of that. But exactly what you touched on, especially for melanoma, you really need a good head-to-toe look. So it's going to be within your hair, it's going to be on your back, at the palms, at the toes, in between your toes and the bottoms of your feet.
And the palms?
Yeah, so everywhere, all the body surfaces are areas that should be examined when you're getting a good head-to-toe check.
How often do you do that?
It really depends on what your risk. So for somebody who actually has already had a melanoma, they're going to be seeing their provider much more frequently than somebody else. But for the average person, even if it's a yearly exam with your primary care provider or a board-certified dermatologist, that should be adequate.
Okay.
When we're talking about risk, you've got sunscreen right there. So tanning, sunburns, all of this is part of figuring this out.
Exactly. So if we burn, especially if you're somebody who burns easily, you could be somebody who has a higher risk of developing melanoma going forward. We do know, unfortunately, the tanning beds do increase the risk of skin cancers as well. So that's definitely something to take into account.
Yeah, we're talking to these old millennials folks who we used to have, monthly memberships to Golden Tan in Burnsville, whatever. Okay, let's talk about some other risk factors, though, in terms of hypothetical people. We have some, these are hypothetical. We're going to start with Barbara, and then you can tell us what some of the concerns that you have for her. Now, Barbara, she looks lovely, but this isn't really Barbara. She's married to Jerry. She loves him very much. She exercises 3 times a week for 30 minutes. She watches what she eats. Her sister, Shelley, though, was diagnosed with breast cancer at 40 years old. So what's your risk concern with Barbara?
So what we're really touching on for her is that family risk. So that's something where she's already past that 40 age, but especially if it's somebody that was younger and had a sister or a mother that was diagnosed at a younger age, that's something that we know can increase your risk. And the important thing to understand is that even in the setting of genetic testing, if genetic testing for that family member was negative, they didn't have one of these genes that increase their risk of cancer, just by the nature that they were diagnosed at a younger age still impacts your risk. So that's why it's really important to understand that piece.
Okay.
Get that family history in there and all those things. Well, Dr. Carroll, how about Gina? She's 68. She's got a set of twins.
She's living her best life.
They are her world. She loves these kids, okay? They were born a little later in her life. Gina was 35, so nobody in her family has a history of breast cancer, but Gina, she goes on walks twice a week. What risk factors is she going to have?
So I think what we're really touching on with her is the risk that of our lifestyle and things along those lines. So some of what can increase our risk is our lifelong exposure to estrogen. So for women that have had children later in life, that can impact our risk. Is that one piece going to be enough that we're considered a high risk? Maybe not, but that is something to take into consideration and something you can talk with your provider about and kind of look at the entire picture of the individual.
You're looking at a 2 geriatric pregnancy lady right here. Said it right on my charts. Oh my gosh. Okay, how about Joel? He's 59. He's been an outdoorsman. He's been fishing since childhood. Loves to spend his days off at the golf course. They go to Florida, and he does his best to wear a baseball cap when he's out and about, but he's not really great at the sunscreen. Oh my gosh, what risks does Joel have? This is hard because being outside and being active is so important and so health promoting.
It is, exactly. So that's why we need to have the balance and really understand our risks and do what we can to protect ourselves. So he obviously is our classic Minnesotan. He's lived a great outdoor life. So he's somebody that we really want to make sure is getting those annual skin exams, making sure we're keeping an eye out for melanoma, but also some of the skin cancers like basal cell and squamous cell as well.
The sunscreen is a big thing, okay, and this is where you bring out the shot glass. It's not party time on a Monday afternoon. That's how much sunscreen you need to be using?
Yep, so if you're
Wow.
thinking about how much sunscreen to apply from that head to toe aspect, it's going to be a shot glass worth of sunscreen.
Okay.
So making sure that first off you're getting it on early, so before you're actually out in the sun.
Yep.
Making sure you're doing an adequate amount, doing that shot glass worth, but also are you reapplying? So you should reapply at least every 2 hours, but if you're on the boat, if you're in the water, if you're doing something active and you're sweaty, you might need to reapply more frequently.
This is such good advice. Before we go, activity level, being active, keeping a healthy weight, and avoiding excess alcohol. You also say those are big lifestyle changes that can help overall reduce your risk of cancer. Thank you so
Exactly.
much.
Thank you both
Thanks
for
for
having
all
me.
you do. Okay,
Yes.
so you can set up a screening with your primary care provider to learn more about cancer treatments and providers as well, though. Minnesota Oncology is the Twin Cities' largest and only independent cancer care provider. They have more than 100 experts in 13 locations. I'm just constantly impressed by what I learn about them. They have new clinics in Maple Grove and Hudson, and you can learn more at twincitieslive.com.